It's Dr. Rimka, and we're going to do a little bit of a series on what is maybe one of the most powerful substances you could be taking. It's kind of maybe part 2 of an intro to peptides that I've been doing. So you may have seen my Peptides 101 lecture, and if not, I'll give you a little bit of a primer, and then I'm going to end up sharing my screen and going through a quick PowerPoint for you. But this is what I want you to know first. Peptides are little pieces of a protein. Think of it that way. So I want you to look at it like this. When you have about 100 amino acids, so little amino acids put together, a bunch of them, it makes a protein. That's a protein. The steak you eat is a protein, all right? About 50 to 100 amino acids or so, we call that a polypeptide. Many peptides. Many peptides make up proteins. Then if you get down to a number of amino acids, like 2 to 50 amino acids or so, we call that a peptide. Every peptide has a carboxyl group, which is a COOH and on one end, and it has an amine group on another, which is an NH2. So I just want you to know that's what it is, like amino acids, a little bit of a sequence, a bunch of those make up proteins. Okay, so when you eat protein, you're pulling out peptides, breaking down to polypeptides, then into peptides, and into amino acids if you use them. Well, what is a peptide? We have these little short sequences, little kind of mini proteins, don't call it that, but think of it that way if you want. They're actually signaling agents in the body. And if you've taken if you're a patient of mine, you've taken any of my courses, you know, I talk about things that are signaling agents and how they change things in the body. Well, a major form of a signaling agent that many peptides are called hormones. Now you're familiar with the term hormone. You have a whole bunch of them, and you might even be taking hormone replacements and different things to augment your hormonal system. Most of those are peptides. There are, in fact, more than 50 naturally occurring peptide hormones in the human body. All right. So what we can do with peptides, you can have a peptide that might be this big, and it does a whole bunch of things. For an example, a real big peptide is human growth hormone. Well, human growth hormone can be broken down into many different pieces, parts, and this peptide sequence of growth hormone does something different than this segment of the growth hormone. Growth hormone has at least 40 clinical known effects on the human body. Well, we can take out shorter peptide fragments of this larger peptide, and so we can use it to get really accurate and very precise results. So we use it in precision and optimization types of healthcare. So again, we can target very specific sites and say, I only want this outcome to happen. So I'm going to use a peptide to go after that and hit that part of the body. All right. I will let you know that the foundation of most peptide therapy is actually growth hormone peptides. There are quite a few. This is not a lecture about that at all, because good human growth hormone levels are considered critical to most of the therapeutic uses of other peptides. Not all of them by any means, but especially when it comes to repair, growth, healing, longevity, sleep, muscle growth in particular, hormonal balance, and many, many brain functions. So I'm only going to go over one peptide right now. This peptide is a little unique in that you actually don't have to be using it to augment growth hormone. So you might not be on any growth hormone. You might not be on any peptides for it. You might not be on the gel. You might not be doing anything around it. And this peptide is still going to give you powerful results. In general, just about peptides, there's about 7,000 peptides that we know about. About 500 of those are being used therapeutically in use and or have clinical trials around them. Of those 500, only 60 have been approved by the USDA for use. Almost all of those are being used in a disease model and are not being used for longevity or wellness or optimization. They're used to treat a disease. Very few clinical trials in general on peptides. These are not patentable the same way a pharmaceutical could be. And so funding for clinical trials is very low. Most of the trials are with animals. In general, peptides, just so you know, are very low risk with pretty good benefits, but there are a few that can be dangerous. And so just trying to do this on your own, there can be some interesting outcomes that could happen. Okay, so we're going to go over one. This is BPC-157. I've done one talk about it briefly, but I wanted to expand upon it a little bit more because it kind of covers so much that I do professionally, and that the 3R Reset course and the Master's Experience course really go over. So this one molecule, this one peptide, could be a very powerful thing to add to your healing support. I am personally taking it right now, and the more I learn about it and experience it, it's quite impressive, and you're going to see why. There we go. All right, so BPC-157, it is considered like the peptide that's going to make you like Wolverine. All right. Wolverine is, a comic character, if you don't know, who just constantly heals and can replenish and regenerate. What we have is that it is a 15 amino acid sequence that's made from a peptide that's made in your stomach from gastric juice. So your stomach makes BPC, body protective compound is what it means. So that's what it's named. This compound is so powerful at healing you, scientists named it body protective compound because that's what it does. Now, the BPC, the /157 part means it took off only part of it. There's a lot of products in the market that are not actually BPC-157, they're BPC. They're whole body complex. None of the research, none of the studies are actually on whole body BPC. All the results are 157. So anybody who's saying they're the same, they are not. So I want you to know that. What makes BPC-157 unique as well is that it can survive the digestive tract. Most peptides are via injections. Most peptides mean you give yourself shots, sometimes twice a week, sometimes 3 times a day, depending on what peptide therapy you're enduring. Some people are not okay with doing that. So certain peptides have been out of the realm of a lot of patients because they don't want to deal with shots. Okay. But this is one of those that is really, really good and still successful in an oral capsule form. Lots of experiments have been done with it as far as especially gastrointestinal things. So there's a lot that's been in labs, in like culture type studies, and it has a lot of clinical results as well. So real humans seem to back up what you find in the lab. That doesn't always happen, especially with peptides. It's used for ulcers, huge one, very, very powerful, helps with bone, muscle, cartilage, ligaments. It's also good for the eyes, which we'll go over, huge in helping the gut, irritable bowel disease, other types of dysbiosis, Crohn's, leaky gut, massive, massive, massive things. So it upregulates genes. So we're looking at things that have an epigenetic impact, meaning what kinds of things can help turn on and off and alter gene code expression and activation. This is critical. So it's doing things that are all about growth and healing. All right. So angiogenic factors, which means how your blood vessels being able to go into thing, and oxygenation and perfusion, which is critical and decreases as you get older. Bone morphogenic proteins means building strong bones, okay, repairing that. Growth factors all over the body in terms of cellular response, and nitric oxide synthesis. Nitric oxide, if you've seen some of my other videos that I'm talking about in terms of immune response and what the sunlight does and what redox potential does, nitric oxide synthesis is critical to overall health systems and is a good indicator of your redox potential and your electrical charge and your battery life, all right? This helps with that. All right, so it has a few different categories. Repair and growth is kind of what it's known for, all right? And you can see it does what I've already mentioned, kind of the bone, ligament, muscles, and tendons, and skin healing. We don't actually know the full mechanism. But remember, this is something that's made by your stomach naturally. So we're still trying to figure out the process of understanding the stomach is making this on purpose, and it helps the digestive. So it's designed to heal and repair your intestinal tract from foods you eat. If you happen to eat a poison, this is designed to do things. If then we'll talk about some of those things, why it's capable of doing this later. But again, they don't really know why it's doing this. Proangiogenic, meaning, again, blood vessels. So if you heal, you see a picture there of an elbow, you have an injury, you have to have blood flow moving in to get something to heal. Why wrists don't heal at all, why we're so scared if things get injured and people have carpal tunnel, it won't go away. Very little blood flow. Why meniscus and those type of injuries in your knees don't get better, there's no vascular blood flow. Why discs don't heal in your back, there's no blood flow. This really helps with that. It helps with, like I said, growth factors and the nitric oxide synthase. Some of these are repeat. The studies, there's a lot of studies about showing that this is working in multiple systems simultaneously. Again, they're not really sure every mechanism. It's like so many mechanisms at once, and it's like the increased blood supply and the growth factors, and absolutely it decreases local inflammation over and over again. So as far as whether it's an acute injury or a chronic injury, it's decreasing that inflammatory response. It also helps your body make new cells. So new healthy cells to replace the damaged cells. That's all a good thing when it comes to, repairing yourself. Kind of getting a claim to fame among clinicians for its gut healing capabilities. It's starting to be talked about in the circles of physicians and other clinicians I work with as maybe the greatest gut healing compound they've ever come across. Way better than a whole bunch of other things. And it's just doing more in a shorter amount of time with less other things coming in there than we've really ever seen before. Doesn't mean we might not have to add things to your protocol. Don't think you need to throw away everything you're taking, but this seems to be knocking everything out the park. It does this because it's lots of studies they've straight up done in labs, like they create intestinal damage and see what this does to it, and its level of repair and recovery to intestinal cells is extraordinary in an exponential way, that it helps with the thickening of the lining again, the making of the new cells, increasing the blood supply, and it does it over and over again, and it translates into clinical use with people. Again, here we go. We talked about the ulcers. It has a very strong cytoprotective benefit. What does that mean? It means the actual cell inside the water in the matrix, which you talked about gel water and how important it is. This is protecting that cell very, very, very strongly. Again, they're not really sure why. It probably has something to do with the matrix structure, but who knows who's going to study that. Over so many more studies that just constantly showing, so just hitting it gut. Think of that. Again, there's a picture, you see the stomach, and then the thinner thing goes all the way, that's your small intestine in this image, and then it goes to the large intestine, and that goes all back up and then comes out the anus, you guys. It's made in the stomach for a reason. It's all going through there, healing everything. And then we know as things get down, things get absorbed. And this is attaching itself to things and getting absorbed and going systemically in your natural way. Well, the number of gut disorders we have and stress and anxiety, this, body protective compound, the whole compound isn't studied the same way like hydrochloric acid in the stomach is. So just imagine what we know about what that does and how it ruins your digestion and bile and does so many other things. Imagine when this has been going down as well, and you can't produce much of it anymore, and how it has systemic responses. I don't know for sure, but this may even rival the Ion Biome Restore older product that I've used. Now, I know that its claim to fame is that it is a redox signal for the bacteria that live there. So that's something very unique that it does. And it creates like this barrier, impenetrable wall of glyphosate and a bunch of other toxins, but nothing seems to manage glyphosate. Well, BPC-157 ion biome. I hate the new name, you guys. It stops, it makes a wall, but it doesn't actually cause healing. It makes stops damage and tries to let your body come in and heal it. BPC-157 is the thing that comes in and says, okay, let me increase all of the healing and make a thicker wall, make it stronger, make it new cells. So the two together might be a really, really powerful 1-2 punch on gut issues. I wanted to make sure I mentioned that. It also has major brain repair. It does all this stuff in the brain, but these same things I'm going to say, it does it on all the peripheral nerves as well. It's fascinating. It's pretty ubiquitous in its powerful regeneration qualities of all tissue, including your brain and your peripheral nerves. So it supports you in making dopamine and serotonin. Dopamine, remember, is your reward, feel good, impulse control, make good decisions, have emotional control, and it's involved with addictive behavior. So it helps you make that. It also helps you make serotonin, which is your happy, sustained happiness, mood modulation. So you can see very quickly that how it works as an antidepressant. It also protects against dopamine depletion with amphetamine. So when kids are on, an adult on ADHD medications, amphetamines, dopamine gets depleted even more. This kind of helps with that. Now, there's been a few anecdotal cases that people have said that they feel like their amphetamines don't work anymore because the BPC interferes with that, but there's been no research saying that. So, and most of the clinicians I know using it said nobody's ever seen a patient that has said this before. What they suspect is it's kind of reported from these biohackers who've been using this. Most of the peptides have been used by these biohacking performer people. They're not used, by doctors all over the place. So it's people who are pushing themselves, athletes and Dave Asprey types, stuff like that. They've been using this stuff for a long time, experimenting. And they also do a lot of experimenting with taking amphetamines more for a peak performing standpoint. So we suspect it's really about that, not more of the, other way it's being used. It protects against ischemic reperfusion injury. What does that mean? You have an injury and there's a trauma, there's no blood flow. It protects that. So think stroke, think traumatic brain injury. Nitric oxide stabilization as well. This is critical to normal function of protection and antiviral function, blood flow. But nitric oxide in particular with blood flow and cardiovascular health and oxygen. As a side note, we're in coronavirus time, and what's looking with oxygen and the heme, the biggest way that might be the pathology is that it's dumping off. It's making the red blood cells have no ability to carry oxygen. We know that's a big part of what's going on. Might not be a lung problem, it might just be an oxygen problem, which is why I've suggested nitric oxide, why people in the sun and having nitric oxide helps, why what's really going on. I'm filming it right here. We don't have all the questions, but it's just an interesting thought. Definitely has nerve regeneration capabilities. We don't know how far down and how much, but it's there. A huge thing it does that, and it's proven, and the studies show it, we got it, is that it stabilizes the gut-brain axis. So I've talked about this in different parts of my website, in different places, but as the gut goes, so the brain goes. This is why you'll never see any complex disorder such as autism. It doesn't have a severely damaged gut. These things are intimately connected. There's a highway of communication, and if you have a leaky gut, you're going to get a leaky brain eventually. It's going to happen. And as it definitely looks like once that gut is really healed, and this seems to do it so well, brain disorders that are caused from the gut disorder just go away, and people's anxiety and depression and other mood disorders that were coming truly from a gut disorder, which things like the GAPS diet, gut and psychology syndrome diet, and lots of other diets are trying, specific carbohydrate diet, other things like that are trying to address to stabilize brain disorders such as autism or schizophrenia or bipolar by going after the gut, have huge impact. This may be even better than that, or once you add it to that protocol, it's just going to explode. But it's very powerful at doing that. It in and of itself, because of the gut-brain axis thing, and just what it does with dopamine and serotonin and GABA, it's extremely anti-anxiety. So this is huge. Now, again, this wouldn't be, BPC-157 isn't the thing you say out of all the peptides. There's a whole class of peptides that are just for brain issues that you go, well, these are our top choices, that you would go, well, that one does anxiety, this one does this one does this, right? But this is one of these overall things that every clinician who does peptides is like, well, if you got to pick one, you're going to go BPC-157 because it just does so much for so many people with so many issues. It's kind of the groundwork. And then if that doesn't manage it, you know, we can start adding these other ones in, right? It also helps with benzodiazepine withdrawal. So benzodiazepines are a class of medications that are highly addictive, that are used often for sleep and for anxiety. And this is something I've done in practice for a long time, is help take people off of this. It's actually so dangerous. People can die. You never want someone just coming off, if they're addicted to these, they cannot go cold turkey. It might kill them. I've seen this take 200, 300 neurofeedback sessions and a year of working in concert with therapy to get somebody off benzodiazepines once they've been turned into an addict. It's not easy, and you must go slow to protect them. This is working to help ease that. So that's anything that can be done to ease that difficult process for somebody is a huge thing. There will never be one magic bullet around some of these things. You need to understand that. Okay, but super exciting. Like when I've been learning more about the neurological implications of BPC-157, I'm so happy I'm on it, and I'm not going to come off of it anytime soon. You know, it was like, well, let me take a couple bottles for heal the gut. You can heal most gut stuff in a couple months, but I don't want to come off of it just because of everything it's doing. Dopamine, which we've talked about, GABA, which you know is super calming, serotonin, gives it this antidepressant quality as well. Extremely neuroprotective in traumatic brain injuries. So if someone's had traumatic brain injury, get them on it. If they're in an activity that it's likely, such as football or something, they should be on it because it helps protect against that. It helps with nerve regeneration. So we'll talk about some of the issues and conditions where that's an issue. If you have diabetic neuropathy, this might help. No guarantee, but just understand what it's doing. It also counters the damaging effects of alcohol. Now, again, doesn't mean, great, I'll take this pill and I'll just be drinking, but it's nice to know it's actually, that is what it's doing. And here's one of the studies that I have a few studies here and there listed for the researchers in you that want to look up some of these things and you know, go right to the journals where there's some quality information, but there's already a lot out there. So it's mood enhancing. So we have actual tissue regeneration, we have tissue healing, and we have neurotransmitter supports that all move towards an anti-anxiety, antidepressive, traumatic brain injury healing aspect. Pretty damn awesome. Clinicians actually just often refer to this as because it's almost like a miracle, too good to be true. This stuff is good. Now, it's not like you start taking it in 2 weeks, you know, you're going to turn to a 6'5" bodybuilding ripped person with no pain ever again. The body is going to take time to heal. All right. Here's an interesting study that actually, there's many these types of things, but again, it was all about traumatic brain injury, and it was able to preserve someone's consciousness, their ability to stay conscious and remember things, lowered their brain edema, so they didn't, you know, it stopped them from going into a coma, stopped hemorrhagic traumatic lacerations, little cuts that are happening inside from someone from a major injury, bleeding, again, all of those things, mitigating that. If you're taking something and you get in a car accident and your body's able to heal so quickly and have a more controlled temper response, that could be the difference if a neurosurgeon is called in at 4 a.m. to deal with you or not. This is a huge deal. So let me make sure, blah, 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 blah. Something that's really interesting, what it does, so, because I alluded to, I want to be clear. So it's healing. BPC causes healing, but it also causes protection. So having it decreases your rate of injury, the severity of injury, how physical trauma is going to impact affect you, the level of how hurt are you going to get, and then how quickly you can recover when you're on it. In fact, this says because of its decreasing your risk of injury, lots of pro athletes have been on this for years. So I said it's been in the world of peak performers. They've been on it for a long time. And eventually it got hit on the banned list. They all took it anyway because they had no way of testing it. Well, there was a test recently in the past couple of years. So now they're taking them, people are having to come off of it. And we are seeing injuries come up. Now, who knows what the reason for all that is? I do think it's pretty stupid. This isn't a this isn't a artificially enhanced performance drug or peptide or anything. It's not a steroid by any means. It doesn't do anything. Your body makes this in small amounts normally. We've taken a small part. It helps prevent injury, helps keep people out of the trainer room, help keep people out of the surgical room. I really don't get why they have it banned, and I hope somebody will fight to make that stop. So a little bit of something about skin and eyes for you. It's really interesting. Again, and I'll talk about it. You can actually even get creams for it, but even just taking it orally. So it helps with wound lacerations, burns on your skin, and actually in your eyes. The BPC-157 eye drops are prescription only, but I thought this was an interesting study. And there's your authors. So the black box is your control, the bars, BPC control. And then you have different degrees of dosages. So the next color you can see in the little key is the picogram, nanogram, microgram. So you're looking at just how much of it they were getting. And then there's a number of days. And so you see the defect in the eye, there was an eye injury, and you look at where they were with when they're being treated. You can see incredibly drastic results in that the lightest shade, you get to 24 hours. I mean, you look at that number and then you go to 32 hours. I mean, compared to the control, it's huge changes in where somebody is within 48 hours. It's gone, if you're on BPC. So, all right, let's talk a little bit about dosing. Like I said, most peptides are available in these injectable forms. So in injections, there's kind of like let people know what you do. It's in micrograms. You have to, inject daily. There's a couple different ways of 250 micrograms, subcutaneous, just, in there, not needing to get deep into a muscle or anything, small little insulin needles, 250 micrograms, 300 micrograms, you would work with your doc on your deciding. Eye drops comes like in that form, typically prescription. It's nothing I've ever used or anybody's even mentioned to me about that. The oral capsule is what I take, and it's what most people are taking, so they don't have to deal with injections. And it's 500 micrograms. I should have brought a bottle with me. A day. You can take 1 a day or 2 a day. 2 a day is considered like the first 30-day kind of intensive treatment. Now, if somebody is injured or has a really long history or is really struggling, they may want to stay on 2 a day for a very long time. I know 2 doctors that I know personally, husband and wife team in their 50s, they do Tough Mudders and all kinds of other physical stuff and rock climb. They were taking 2 a day for 4 months, and then they came off of it. They wanted to see, and they just say, we feel so much better taking it. Like, we're just getting back on it, not going to come off. Like, why? They might go down to 1, but for them, they could afford it. And it was, it is dose dependent, but the maintenance dose is typically 1 a day. And so that means 1 bottle is going to last you 2 months. Okay. But if you've been sick a long time or something going on and you're like, well, I want to do a little bit of loading for a couple months, totally safe to do that, just so you know. And I'm going to decide how much. I'm more of a loading kind of a person, so I may choose to go that route. Just so you know, there's also creams. And so what people would do, they don't usually use the cream as a primary. They're usually taking a capsule. So let's say they might be taking 1 capsule a day, and they would use creams on areas of injury. If they have, a shoulder injury or a knee injury, or again, if you're athletes doing active stuff, they just go with where the injuries are rough that week, where they got hit, where they fell. Very, very powerful. Just in the creams, I wanted to give you the information. AOD, TB 500, the copper, those are other peptides that are designed to work synergistically. So people often, there's little like peptide stacks. So if you were to see these online somewhere and you're like, what's that? I'm not suggesting you starting these things, but I want you to know where this is, because I really suspect in a couple years you're going to start seeing this all over the place, and I want you to be a little bit ahead of the curve. People are also doing sometimes direct injections into injured muscles or joints, and even some physicians have been doing them right into organs, injured organs. These are a little bit off-label ways of doing it, but people in practice can do all kinds of things that they want to do. I would never suggest you do any of these things that you don't know what you're doing. Okay? I wouldn't. I'm not. That slide was just a lot of educational purposes only. I suggest you take the oral capsule form from the Apeiron store. I know it's quality. I know it's good, and that's what I suggest you do. So, you know, overall, like, let's just talk about what it does, right? Why would you take this kind of, you know, powerful peptide wonder drug? Because it's a general body repair. You want to just be a little bit of like Wolverine, regenerate, heal, think of longevity. That's what you would think of. Protection against injury, healing faster, leaky gut issues. So gut issues, huge. Any type of dysbiosis, gut problems, you would commit to being on this for at least 2 months. Muscles, ligaments, tendons. If you're going to start becoming, you say, I really want to get in a workout regimen and I'm going to rebuild my body, I think it's a great idea to be on this while you're doing that, right? It just sets the stage up to make sure you're safe and well. Skin, eye issues and burns. And again, burns are a tough thing to heal. So I just love the idea that I'm on it now, that my body is going to be able to heal faster no matter what happens. Now, there's also very big brain considerations, which is really interesting to me. This would not be what you would think of as your primary first thing. You think, well, I have a stroke patient, cardiovascular, you know, issue, coronary issue. You don't go like, well, BPC-157. There's a whole other class of peptides just for the brain. There's many other ones. I'm not going to get into those. But this does augment and help. Alzheimer's disease is what that means, and Parkinson's disease, and MS, spinal injuries, depression, and anxiety. There's also a lot of people, there's no clinical trials on this. Lots of clinicians, their patients report that there might be very strong antiviral things with this, because people with cytomegalovirus, virus, Epstein-Barr, HIV, flu viruses, chronic Lyme, which again, I know are bacterial. That's a Lyme is some interesting things that are going on there. All have a lot of anecdotal reports of getting better and better and better and recovering from these things faster. You know, I'll just leave it at that. We don't know, but because of the nature of where we are with building our immune system and the antiviral situation of coronavirus of April 2020, I mean, if this is a year from now and you're watching, you will remember what was going on in the world in March, April 2020, and all of the things we were dealing with viral states. So I am taking this right now. I'm glad I am taking it. I have been around a lot of sickness and I'm not getting anything at all. Who knows? Is it because of this? It's because of exosomes, but I don't really care. I'm just happy to build my body to get where it needs to go, however I need to get. And it's a very easy thing for me to do. I think that's about it on BPC-157. I just wanted to tell you a little bit more about it, and then just general healing repair, because there were some possible immune benefits and really strong brain benefits that it just seems to work really well with what I do with my client base, and particularly in the 3R and the master's group and what you guys are getting into. So I hope that was helpful. Call it a course. See you guys.